Good evening and welcome to Health Exposures. I'm Deborah Arneson, your host for the evening, and tonight we have Christina Pfeiffer with us, a certified colonic therapist, and we want to say thank you to Christina for joining us. But before we go on from here, I'd like to let all of you out there in viewership land know that we're dedicating this Health Exposure show to one of my dearest friends who unfortunately passed away last weekend, and he was probably the most wonderful individual, and he was my champion when it came to helping me promote my career in the industry of alternative health, and his name was Sid Luckman. So Sid, this show is for you. Wherever you are, I know you're in heaven looking down on us. So we'll go from here. Christina is a certified colonic therapist. We're glad to have you this evening.
I'm glad to be
here.
And
it's important to let people know about their good health and certainly about what they can do to make sure and ensure that their colons are very healthy. And it's something we don't talk about, we don't think about. It's almost a taboo subject in this country. With the assistance of people such as yourself, it's becoming more prevalent and more explored and certainly more examined out in the open, in a sense, so that people realize that a healthy colon is an entirely healthy body. And if you don't have a healthy colon, you don't have a healthy body. Correct?
Correct.
Okay. So to be a colon therapist, you need to be certified, or it's recommended that you be certified. Why?
Well, you have to be certified in certain states. Illinois, there are no laws regarding certification. You can just open up, you can even have a colonic center in your home, and there's no problems with that, but according to the law. But it's really important to ask for certification because of the anatomy. You need to know what you're doing. Colonics are evasive. Water goes 5 feet into your large intestine. So it's really important that you know what you're doing.
So you have to have a little bit of a basis of anatomy and physiology.
Right.
And certainly some education as to experience with patients, so you know what you're doing and if the patient's uncomfortable, etc.
Right.
Good idea. And the certification process is something that you obtain to become a certified colonic therapist.
Right.
So it is recommended that people who seek colon therapy seek a certified individual who has experience and training. Okay. Now you opened Colon Care here in Chicago, near Chicago and Clark,
right,
downtown location, almost within the last few months or so, right?
Well, in the past year.
Okay. And tell me, what compelled you to go into this business, and what is your mission in this industry?
Well, we opened the business along with nutrition consultants. We're in the same space, and it's the first holistic center in the downtown area. I love working in conjunction with them because not only are you talking about the food that you're taking in, that is so important in regards to colon health. You know, I have had discussions with you where you had said that you had colonics in the 70s, and no one told you anything about you know, what you should eat,
right?
What exercise, you know, water intake. You know, you went and got colonics because you thought that was a good thing to do without really knowing any way of changing your eating habits and such.
I was a very constipated 20-something-year-old. I used to eat French fries and burgers and Cokes. If it wasn't fried, dead, you know, carbonated, I didn't eat it. So it's true. I was constantly dealing with constipation in my 20s and constantly going for colonic therapy, but I would not change my diet and constantly had the reoccurring problems. So.
Right, and a lot of our clients are pretty much, you know, they know what to do. But there are some people that need that extra help with their diet. So having nutrition consultants there, it really helps. It gives them a choice. It gives them another option to not only see me or, you know, my other therapists, but also to get nutrition counseling.
So is your mission also to educate people? Is that what you do as a colonic therapist? People ask about their colon and what's good, what's bad, what's healthy?
Absolutely.
Okay.
Absolutely. Just the whole healing process. I mean, it's all inclusive.
That's wonderful.
It is.
So why is a healthy colon such an important issue?
Well, pretty much majority of all diseases start in the colon. So if you don't have a healthy colon, eventually something's going to happen. If you have a buildup of toxins, it's really important to keep that area clean. I mean, that's the last stage of digestion, and there's so many things that can go wrong if you're not moving properly.
So just a sidebar real quickly, Christy. I know that as in my nutrition practice that I deal with a lot of people who talk to their doctors and their doctor will say to them, you know, oh, you shouldn't have colonics. But if I'm not mistaken, didn't colonic therapy begin with the medical community in the late 1800s, early 1900s? That was what they used to help people heal.
Absolutely.
For the most part. I mean, that was before the inception of antibiotics.
Right.
Right?
Right.
So colon therapy's been around for a long time.
It's not a new fad. Absolutely not. It is a shame that the medical field no longer supports it. I'm not quite sure why. Maybe it's too time consuming because no matter what your ailment was, you got a colonic when you went into a hospital way back when. Not so anymore.
Now you
they
get
much rather cut into you and take out a portion of your colon. That's their remedy. And that's unnecessary. I mean, there are preventative measures, and colonics is part of that.
That's really sad. So we need to have a healthy colon to have a healthy body. Most of the diseases that we know of, I know breast cancer starts in the colon.
It's the same type of cancer.
Okay. So again, it's very important, I think, for people to realize that, you know, we have one of the highest cancer rates in this country of any industrialized nation, right?
And colon cancer is on the rise.
It is still on the rise.
It's unbelievable.
So it's still number 3?
Yes,
the number
but
3 killer?
It will bypass. I'm not sure what the second is.
Breast
right
and
now.
prostate.
Prostate as well. So it will be second by year 2000.
So you folks better listen up because we're talking about colon cancer. I mean, who wants to deal with cancer, period? Hopefully, you know, you take a preventive stance in your life, and people who tune into the show are of that mindset, just like our good dear friend Sid, you know, is and was. And, you know, it's people who take a proactive approach to healing themselves that begin to turn a corner and make a difference and avoid the onset of very serious diseases in this country. So tell me about the colon a little bit and tell our viewing audience. It's a muscle.
It is
right?
a muscle.
If you don't use it, you lose it, just like our biceps or our triceps.
Sure.
So is that what happens when you become constipated? The colon actually loses its flex and becomes rigid?
It does, but not only that, it also becomes very polluted.
Maybe Bill could turn to this picture of the colon over here.
The large intestine is, on average, for the average adult, about 5 feet long. It starts in this area. The small intestines are not, you don't see it, it's not pictured here, but it connects in the ileocecal valve and comes up around through here and all the way down. So that's about 5 feet. And everything is excreted through the anus. When the fecal matter does start here, it's pretty much liquid. And then as it moves on, it becomes more semi-hard, semi-mush, and then down here is mush. So majority of the population have many, many problems in the descending area, not only because the fecal matter is a formed stool, but also because there are all these twists and turns.
So we've got the area down here, the ileocecal valve that drops into the cecum, and that's called the region of worms, it says here. That's 107 degrees, right?
Yep.
It's a hot area, it's a hot spot, and that's where cancer tends to occur.
And majority of bad bacteria.
Okay, and parasites. Worms.
Worms.
So it's very important that this thing sphincters along every day. It moves along and inches its way along, because it moves incessantly, from what I understand,
It's
correct?
supposed to, almost like a snake shedding its skin. I mean, that's kind of the image that I give people when I tell them.
Constantly moving and clearing itself and creating healthy new cells and shedding old, discarded, toxic cells.
Right, and also you also have to eat enough in order to push things along. I mean, the muscle can only do so much, and if there's no food in there to push along, that's how constipation starts as well. And women starve themselves, you know, they eat 1 meal a day, so of course that's how constipation, it's going to be chronic.
I see that all the time. I
I'm
had
sure you
a young lady who came in just the other day, and she goes, "I'm not moving my bowels." And I said, "Well, you're not eating. You're eating 670 calories a day. How do you expect your bowels to move?" I said, "You don't have enough food to nourish anything except the heart and the brain."
Right.
So, you know, starving's the #1 reason, as Christina just said, for people not to move their bowels every day.
And number 2 is eating the wrong foods when they eat, or if they eat.
So what are the wrong foods?
Gosh, highly processed, fried, things that are not alive. Basically, you know, anything that's packaged, adulterated, not enough water, drinking lots of soda, coffee, sugar.
All the things
dairy,
Americans tend to consume
even
too much
wheat.
of.
Wheat is a big problem.
Why?
And many people think, oh, whole wheat is, you know, that's
Healthy.
good for you. And it's not, because it causes a lot of fermentation, which causes gas and bloating.
Mm-hmm.
It's a high allergy food because we've done so much of it.
Hmm.
And that I learned from you.
Hmm. So it's a good idea to watch wheat if you have a lot of gas and bloating, and dairy, right? Those two.
And sugar.
And sugar. Oh, what's left? Look, my client sent me, what's left if I can have wheat, dairy, and sugar? What's left? There's nothing left. Where's my pizza going to fit into
fun.
this?
You just have to be creative.
Yeah, you can have fun and treat yourself to those things, right? So we have to clean our colon out. We have to cleanse it. How do you suggest we do that?
Increasing water. Water is #1 priority. I say that time and time again. Usually when clients come in, when they're not ready to see the nutritionist, I have them start with water, because majority of people do not drink enough water. Depending on your size, anywhere from 8 to 16 cups a day.
8 to 16 cups a day of water. That's a lot of water, you guys.
Yes.
It's a lot of water.
But, once you get into that momentum, you miss it, you crave it. So it's, water is
How
just...
much do you drink a day?
Gosh, almost a gallon.
Do you really?
Yes.
That's wonderful.
On the days that I'm really good. There are some days I'm not perfect. I mean, I lax as well, but...
Your skin is beautiful.
Oh, thank
you. So it looks like it's hydrated, no doubt about it. Okay, so you need water to clean the colon?
Right.
And what else?
Fiber.
Fiber. And where does fiber come from?
Fruits, vegetables, whole grains.
What's a whole grain?
Something that's not processed.
Okay.
Mostly they say that wheat and breads, but and white rice. White rice is a big problem as well.
So brown rices would be okay.
Yes.
Okay. And a whole grain like amaranth or kamut or
quinoa,
spelt?
absolutely. All of the wheat substitutes.
Okay.
Those are great.
Even beans, I would think legumes would be fibrous, huh?
Yep.
So how much fiber should people have every day?
Well, grams, it's kind of hard to tell with the body weight and size. With the fruits and vegetables, you should have at least 3 to 4 servings a day. With the vegetables, you should have at least 4, 5 to 6 servings a day.
Wow.
And I know that people aren't getting that.
Yeah. How many people out there in viewership land actually eat 4 cups of vegetables a day or 3 pieces of fruit? Raise your hands. Nobody.
Not many.
Not many, yeah. So, I mean, I know the American Cancer Association did a wonderful study a few years ago telling Americans that they could actually offset the onset of the 3 most popular cancers, colon cancer being the 3rd at that time, if they would consume 9 servings of fruits and vegetables a day.
Right.
And you know what, with that you bring tons of not only fiber but water, because those foods are very hydrating, right?
Right, they do. And it's also a good idea to try and stick to organic as well.
As much as you can do organic, or grow your own garden.
Yeah,
that would be a good idea. Okay, so the live foods have to come into the body to make enzymes, which also help to breed and create our own bacteria.
Right, the good bacteria.
The healthy bacteria. How many inches of stool should Americans look to pass every single day? And everyone gets really squeamish when we talk about this, so pay attention. This is good.
Anywhere from 18 to 28 inches, so 2 to 3 feet
of stool a day.
Stool.
How many people do that?
Very, very few.
Okay.
Very few. I can't even say half of the American population, or even a quarter. It's really hard to say, because majority of the people that come to see me, they don't move at all. It's hardly 6 inches a day, if that, if 6 inches a week.
So if we can go back to the colon chart again here, how many inches is 6 inches on the colon?
Well, this is half your colon, so that's 2.5 feet. So probably up to here.
So that's about 6 inches. So if you're only moving 6 inches of feces every day, you're only moving up here to this through the sigmoid area.
Right.
And I see that there are all these little numbers and